This is a very interesting case, and I want you to bear with me. It's going to be a bit of a long discussion. This patient is 57-year-old that presented with sudden onset of severe headache. She had the first CT scan without contrast, as you can see over here, and it shows this area of hyperdensity, kind of maybe parenchymal lesion, but there is blood, acute hemorrhage within the ventricle. On the left side, you see left lateral ventricle, you see some blood, you see a bit of blood over here as well in the frontal horn of the right lateral ventricle. As you go lower down, you see that there is an area of as well some hyperdensity within the subarachnoid space on the right side, some within the sylvian fissure as well over here. So with this mass like lesion that appears to be maybe parenchymal, initially the thought was that there might be some hemorrhage within the thalamus, but then we did a CT with contrast or CT angiogram, and it showed that this was in fact a large dilated vessel. It is more like a vein, and then you can see this kind of tortuous appearing vessels, and it goes into the middle cerebral artery bifurcation. Here there was suspicion. The patient actually was referred to us with suspected ruptured middle cerebral artery bifurcation aneurysm on the right side. But when you assess the images a bit more carefully, you see that this is a dilated vessel which is communicating with this dilated vein, and in the reconstructed images it becomes much easier to recognize that there is this large vein. You see that this is some supply, a dural supply that drains into this vein, dilated. It's close to the vein of Galen, but it does not drain within the straight sinus, so it's kind of a large venous varix, and this venous varix is communicating across to the right side into this dilated vein. It is isolated, separate from the artery. This is the artery, this is middle cerebral artery, and one segment over here. And this vein has two components, two dilated components above and below this middle cerebral artery. So this is in fact a venous varix. It has no arterial component, and this is a hemorrhage. Most likely the hemorrhage started from this dilated venous varix that bled into the ventricle due to the location of the hemorrhage. It is probable that this hemorrhage leaked from the ventricles into the subarachnoid space rather than subarachnoid hemorrhage starting within the subarachnoid space. We brought the patient for an angiogram, and this is the angiogram. This is a common carotid injection. You can see that there is some flow going into this venous varix, which is dilated and draining across to the right side. You don't see any of this draining into the sagittal sinus, vein of Galen, or the transverse sinuses. This is a lateral view of the same injection, and again you can see that there is some flow coming through this branch, which is an occipital branch, draining or supplying this part of the kind of a small nidus, but there was no major supply from intracranial middle cerebral arteries. You can see this small branch, which is a meningeal part of the meningiohypophyseal trunk, that is supplying as well or feeding this part of the vascular malformation. When we did the vertebral injection, you can see that there's also some flow coming in from the posterior circulation that drains as well into this part of the malformation. Then we tried to do the embolization. Initially it was difficult to do the cannulation due to bad anatomy. After that we were able to bring the patient back another day and do a long sheath. We placed the long sheath at the bifurcation, and then this is a difficult angle to make, and then you have to go through this branch, the occipital branch, and go deeper. Eventually we were able to reach to a good position over here, and we used a balloon microcatheter. I hope you can see here the markers. These are two markers of the balloon. This is the tip of the microcatheter. We were able to do the injection from this location and fill the AVM with the embolic material. This is the initial phase where you have embolic material reaching to the nidus. There's still some supply from other branches. These are the meningeal branches we were talking about earlier, and at the end we were able to reach this kind of complete occlusion of the vascular malformation. At the end, this is the embolic material moving towards the part of the inferior sagittal sinus, which was also draining this vascular malformation. But this is a complete angiographic cure of this AV malformation. We did also an injection from the posterior, for the posterior circulation, left vertebral injection, and again you see that that part of the vascular malformation is completely cured. Patient was stable neurologically without any sequelae after the procedure.